Rashes are, as we know, a frequent complaint in the pediatric emergency department. And in my own opinion, they are also one of the trickiest things to diagnose. Many of them can look deceptively similar to one another. And it's often a challenge to distinguish between what's benign and what could be something far more sinister as far as a rash is concerned. Now, as we sort through the possibilities and try to catch those red flags, we also need to keep in mind the more stereotypical, milder causes of pediatric rashes. Those that can seem dramatic but are usually harmless. Now, recently a patient came to me with an intermittent rash and bright red cheeks. Now, that classic appearance immediately brought one condition to my mind. So let's take a few minutes to revisit what we call as Parvovirus B19 infection in children, which is also commonly known as fifth disease. So the first question is, what exactly is Parvovirus B19? Now, it's a small non-enveloped DNA virus from the Parvoviridae family of viruses, specifically the Erythroparvovirus genus. While it's often associated with relatively mild illness in healthy children, it's important to remember that it can cause more serious complications, like especially in those with weakened immune systems or those with underlying blood disorders. Now, epidemiologically, Parvovirus B19 infections are seen all across the globe. Infections are most common in children between, 5 and 15 years of age, and outbreaks tend to happen in settings like schools and daycare centers. In temperate climate regions, we see spikes in cases during the spring and fall months. Now coming to the question, how is it transmitted? Now, it is transmitted primarily through respiratory secretions like those through coughs and sneezes. But it doesn't stop there. Vertical transmission can also occur from mother to fetus during pregnancy, and that can sometimes lead to serious complications. This virus can also spread through contaminated blood products, and as you would expect, it spreads rapidly in crowded environments like classrooms and nurseries. So let's take a quick look at how this virus operates within the body. So let's talk about its pathogenesis. Now, Parvovirus B19 has a particular affinity for red blood cell precursors. It specifically targets erythroid progenitor cells in the bone marrow by binding to the P antigen on the surface of the red blood cells. Now, once inside, the virus hijacks the cell machinery to replicate itself. Now, this process leads to destruction of the erythroblasts and, in turn, a drop in the number of circulating red blood cells. In healthy children, that might not cause any problem. But in certain individuals, this disruption can be quite significant. Now, let's talk about how Parvovirus B19 presents clinically, and because this is where it gets quite interesting. Now, the most well-known presentation is what we call as fifth disease, also known as Erythema Infectiosum. Now, it's classically seen in children. Early symptoms are quite non-specific, like low-grade fever, maybe accompanied by headache, lethargy, and generally being unwell. Then comes the hallmark, that is the bright red cheeks, often described as slapped cheek appearance, followed by a lacy, reticulated rash that spreads to the trunk and limbs. This rash typically resolves within, 1 to 2 weeks, though sometimes it can flare up with the sun exposure or sometimes even with emotional stress. Another presentation which is quite interesting is arthropathy or joint pains. While this is, more common in adults, it can occasionally affect children too. These joint symptoms can linger on for weeks or even months, but I would say they are rarely debilitating. Then there is the more serious complications, which we call as aplastic crisis. Now, this is especially concerning in children with underlying hematologic conditions like sickle cell disease or thalassemia, because in these cases, Parvovirus B19 halts the red blood cell production, leading to severe anemia. These children, therefore, may present with fatigue, they may present with pallor, and sometimes in more severe cases, they may even present with high output heart failure. And finally, also not forget Hydrops Fetalis. Now, if a pregnant woman becomes infected, this virus can cross the placenta and infect fetal erythroblast. And this can cause profound fetal anemia, can lead to fetal heart failure, generalized edema, and even fetal loss. It's one of the most serious, complications or outcomes that warrants close monitoring and possibly intervention. So the billion-dollar question is how we diagnose it. Now, in many children, the diagnosis is clinical. especially when that classic slap cheek rash is present. But when a more definitive answer is needed, we turn to lab tests. Detection of IgM antibodies against Parvovirus B19 indicates a recent or, let's say, an ongoing infection. We can also do PCR testing that can pick up viral DNA and is particularly useful in cases like aplastic crisis or in Hydrops Fetalis. A complete blood count might show anemia and a low retic count, especially in those who have got some marrow suppression. And then you may ask, how do we manage it? Now, in most healthy children, no specific treatment is required. So it's all like conservative management. It is self-limiting and can be managed with supportive care, like hydration, rest, and medication like paracetamol or ibuprofen for fever or joint pain. However, in an aplastic crisis, especially in those with hemoglobinopathies, supportive treatment becomes more aggressive. For example, blood transfusions may be needed, and in some cases, intravenous immunoglobulin therapy is also considered. For pregnant women infected with Parvovirus B19, it's important that they should have close fetal monitoring. In some cases, intrauterine blood transfusion may be required, and in that particular case, amniocentesis can help detect the virus in amniotic fluid. So, coming down to the takeaway of this lecture is that if you see a child with slapped cheeks, a lassie rash on their body, and a recent low-grade fever, always think of Erythema Infectiosum. So reassure the family, offer supportive care, and advise on avoiding sun exposure for rash flares. But always stay vigilant, especially if the child has got a history of blood disorder or if the patient is pregnant, because this small virus becomes much more significant in those cases. Parvovirus B19 may be tiny, but remember its impact can range from a mild rash in most of the cases to life-threatening complication in vulnerable individuals, which fortunately is quite rare. So thank you, my friends, for tuning in, and don't forget, next time you see that flushed, cheeky little face with a rash, think beyond the surface. Think of Erythema Infectiosum or fifth disease, because you might just be catching a case of parvovirus in disguise. Thank you very much. Have a good day. Take care and bye-bye.